Last week, lawmakers on Beacon Hill heard some powerful testimony on an issue which doesn't receive much attention. Here's the beginning of what they heard from one witness. My name for the record is Deborah M. DiMasi. I live in Melrose. My husband, inmate 27371-038, is incarcerated at the Butner Correctional Facility in North Carolina, where he's now serving the 4th year of an 8-year sentence. An inmate struggling to overcome stage 4 cancer of the tongue, struggling not only against a horrible disease, but against a stark institutional indifference. That inmate is Sal DiMasi, former Speaker of the Massachusetts House, and the woman advocating for a change in Massachusetts law, even though it won't affect him, is his wife, Debbie DiMasi, who's pleading to his former colleagues for the compassionate release of prisoners who are either incapacitated or dying from terminal illness. Debbie DiMasi is here now. Debbie, it's good to see you.
Good to see you, too.
What would this mean? How would this work? It's a state law you're advocating for. Your husband's in federal prison. That's why it wouldn't apply. How would this thing work?
What I was advocating for and am advocating for is medical release for prisoners that are dying or incapacitated and are of no threat to anybody.
And you're coming out from having read your testimony, your thing is about compassion for people. A lot of advocates for this are also saying it's going to save the state a ton of dough.
Absolutely.
Because obviously care in that kind of setting is pretty expensive, yes? So my understanding is we're one of only 5 states that don't have such a program. It doesn't guarantee anybody gets released. It's a process.
Right.
Why do you think, I mean, year after year this is rejected. The Speaker of the House, the successor to your husband, Bob DeLeo, didn't seem to be wildly enthusiastic from what I read. Why is there no constituency for that? Is that what the problem is? I
just think that it's a subject, perhaps. I mean, it's a subject that no one really wants to talk about, and
because they committed crimes.
They committed crimes. I think that perhaps people don't want to be looked at as being soft on crime, and it's not a very popular subject.
You told some stories about some suffering. That share one or two of those that were in your testimony.
I was sharing a few stories. One of them is about an inmate that had stage 4 cancer of the liver and died a week after he was diagnosed on a floor asking for help. Literally died on the floor. Another one died in a prison yard, and everyone was called in, and he was left to die there.
And I recall you were here in July. Has your husband sought compassionate release?
That is
from the federal government, from the Bureau of Prisons?
That's something that we're working on, and that's all, just about anything that I can say. But
has he filed such a thing? I'm not going to.
Something that we're working on.
He has. You know, when you were here, it was 3 months ago. You said he had waited July. He had waited 3 months for a biopsy for possible prostate cancer. That was 3 months ago. It's 3 months later. Has he gotten this? And what is this about? Is this about him? Or is this about a dysfunctional healthcare system in prison?
I really don't know. It's very frustrating. He brought that to their attention last October, that his PSA levels were elevated. In February, they said that he was going to have a biopsy. In April, they don't tell you when you're going to have a procedure done, the day, for instance, because families can't know that.
So it's 6 months. Why can't families know that? What's the problem?
Well, I think probably years ago, there were people that tried to escape when they were brought to a hospital.
Because they're going to get at a facility where they're getting some testing.
So he doesn't ever know when something's going to happen. But he's been waiting 6 months now, and that does a lot to someone mentally.
How is he mentally? I mean, first of all, how is he physically? You hadn't seen him in almost a year, you told me, because of financial reasons and scheduling. I know you and your daughter have since. How is he physically and how is he mentally?
He's physically, he's the same. He's very thin. Swallowing continues to be an issue. Every 3 months he goes in and gets his esophagus dilated. Mentally, I think he's incredibly strong, but it's also, I think, very difficult for him. And I know he's very concerned about his cancer, and I know he's very concerned about this prostate cancer.
You said in your testimony, if my husband were here before you today, he would tell you, as he has told me, that a dying inmate has but one hope: to die at home at peace with their family and their God. But death alone in a cold, dark prison cell is all that awaits. Is that what he thinks awaits him? He does.
He's very scared.
When you heard that 6,000 federal prisoners were going to be released at the end of this month, I think between October 30th and November 2nd, and obviously your husband is not one of them, it's mostly drug offenders, not high level, but what kind of reaction did you have to that?
I don't take it personally and think, well, if them, why not Sal? I think the mandatory minimums were crazy.
Don't you take, you've told me a couple times, why don't you take things personally? After you're here, people email and say, well, he shouldn't have committed the crimes if he has all these problems. But the reality is, obviously, universal health care exists in the state in great part because of his leadership. A whole variety of things. He served 4 years of an 8-year sentence. It isn't like he's getting off easy. Why don't you take it personally, Debbie DiMasi?
I can't. If I did that, I really wouldn't be able to get up in the morning. And I can't personalize it. It's something that's happened. It's something that we're dealing with. If I were to live with anger all the time, it would not be productive to anyone, and it wouldn't be helpful to me. So,
the House bill in Massachusetts is 1628. If people want to weigh in, Debbie DiMasi, it's good to see you. Thanks for updating us again.
Thank you.
Appreciate it.